Hello there. We are joined today by the wonderful Dr. Venkat Muthukrishnan, who is part of our Dementia Action Week 3 Questions podcast. So, Dr. Venkat, welcome. I'm just going to do a little bit of an introduction because you have a very impressive list of credentials. And so Dr. Venkat is a consultant psychiatrist, liaison mental health team at the Friarage Hospital. He is also the training program director, core psychiatry training at North and East Yorkshire. And he is the Chief Clinical Information Officer for the Tees, Esk and Wear Valley NHS Trust. So very impressive, but probably the one that we are most grateful for is that Dr. Venkat also volunteers when he is able to for Dementia Forward. And we are always really super grateful, Dr. Venkat, for your support and invaluable input into our charity. Can you just tell us a little bit, Venkat, before I get into the questions, as to how you came to have a particular interest in dementia and sort of what led you to reaching out to Dementia Forward and offering your support to us?
Yeah, sure. First of all, thank you, Fiona. Thank you very much for giving me this opportunity. Not just today, but sort of the whole experience with Dementia Forward has been really helpful. I am a psychiatrist. I'm very passionate, and I kind of specialized in older person's health. And obviously, dementia is a sort of a key part of any older person's mental health service, really. I've been doing memory clinics in York for the last sort of 2 to 3 years. And what struck me the most is we obviously do a lot of diagnosis and we start people on treatment, but then effectively they are, having to kind of do a large part of the long-term management, all the practical aspects themselves, really. There are obviously, some amount of state support, really, but effectively it's there to the patient and to their families. And then that's when I came across a voluntary organization like Dementia Forward. And I know a lot of my colleagues, pretty much everybody in the team, spoke very highly about you guys. And I also felt very strongly that I need to do something in addition to my regular NHS job, where I am kind of giving back something, a little bit, whatever I can, to the care of dementia, because it's just so hard, isn't it? I mean, and these are people who have done their best. They have done their bit more than their bit for the society, and it is a turn of the society to look after them, and yet they are having to go through with this really, really unfortunate illness. And I just thought, I need to do that bit more, rather than just my 9 to 5 NHS job, really.
Oh, well, honestly, thankfully, there are people like you in the world, Dr. Venkat, because, I know that you have your full-time job and that takes up a lot of your space and your family and everything like that. But the help that you give us as a charity is really invaluable. Um, If I'm going to ask you 3 questions, and it's just really around sort of the aspect of dementia and what we're trying to pull together for Dementia Action Week, just so we can have different people talking about the different aspects of understanding this behaviour and what's being done about it in a way that they might never have come across.
Mm-hmm.
So, one of the first question I'd like to ask you, Doctor, is just tell me about some of the positive developments about dementia and some of the challenges that that might bring.
Mm-hmm. And thank you, Fiona. In terms of the positive developments that I see, certainly, I mean, and I've been in psychiatry for the last sort of 15 years or so. Compared to when I started, awareness about dementia is thankfully quite significant. Everybody is aware of it, so that's definitely a positive development. Year on year, we see people who come to us fairly early on in the illness phase, which is very, very important. And yes, we don't have definitive treatments for dementia. All the treatments that we have can only delay progression. But even then, the sooner you come to services, we can do a lot more, and that can make the crucial difference in many cases between being independent for much longer and being kind of dependent and having to go into a care home type environment. So that still is an extremely critical point from a quality of life perspective. So that's definitely getting better and better. So that's really possibly the biggest positive, I would say. And I think that's across the board, isn't it? A sort of a collective effort on part of everybody, particularly organizations like Dementia Forward. I suppose the challenge that comes out of that positive is obviously the awareness is greater, so we are faced with much more increased numbers. So that kind of then has its own sort of waiting list type situations. And again, everybody is well aware of the level of pressures on NHS organizations, NHS trusts across the board. I mean, to be perfectly honest, waiting list for dementia diagnosis is certainly nowhere as challenging as waiting list for some other mental health disorders across the country. But it is a bit of a challenge. So that's probably what I would sort of say is the positive and the challenge that comes out of the positive.
Yeah, and I suppose that's where us as a charity now that we're working a lot more hand in hand with health. So
Mm,
what we have quite a lot that have been designed over the last sort of year or so is our brain health cafes.
mm,
And
yeah,
these are kind of set up
mm,
specifically to
yeah,
try to minimize the challenges around that and the preventative side of dementia as well. I like what you've said. It may well be that you are predisposed to getting it, but we can probably push that time back
mm,
and give you more
yeah.
quality of life. And so that's really important, isn't it?
Yeah, it is extremely important, particularly as the awareness raises, and the preventative aspect of dementia is again probably the second most positive thing that's happening. And again, across certainly the Western world, a lot of work has been done, particularly looking at people who are in their sort of 50s to try
Mm,
and see what kind of preventative measures we can possibly
mm.
put, ranging from diet to exercise to a range of other measures. So yeah, absolutely, brain cafes are important way to go forward.
Yeah, yeah, and hopefully, we'll have that'll just increase as time goes by, and it won't be kind of like that little sporadic thing that we've got at the moment. They'll be out there and everywhere.
Mm.
What opportunities and innovations in dementia care, Doctor, do you see?
I mean, I think one of the challenges with dementia, or for that matter, any long-term condition, and when I say long-term condition, is you have this illness and it's present, for a very prolonged period of time, as opposed to maybe a chest infection or a fever or something like that, where you have a very short period of treatment and hopefully you go back to your baseline. Whereas long-term conditions like dementia or diabetes, for that matter, it's present for a very longer period of time. So the management of a long-term condition is obviously fundamentally different to that of an acute or a short-term condition. And again, the sort of changes with long-term condition means that we need to collect data over a period of time as opposed to getting them into clinic and trying to get details of whatever has happened in the last sort of 6 months to 2 years, because memory problems could be there for months on end. So we bring people to clinic and ask them all that information. Obviously, the person in question themselves is forgetful, but even for the carer to remember all that information can be a
Mm,
challenge, considering that the carer themselves is also an older adult. So we are relying on that, isn't it, in terms of people's ability to retain information for a longer period of time, and they've got to kind of capture all of that. And this is where, again, one of the possible opportunities, as far as I'm concerned, is certainly not the only opportunity, but one of the opportunity for innovation is the whole digital side of things. Now, people would remember as to how during the pandemic, when it was so difficult and an unprecedented challenge, digital was, or particularly digital innovations like virtual consultation, the one that we are doing now over a video platform, before that was unheard of or not known to that extent. That was probably the biggest savior that
mm,
enabled healthcare to be delivered. And what that means is you also can collect data. So data is another very important aspect, particularly when it comes to long-term condition. So that is something that I'm kind of holding out a lot of hope. And there's already a lot of innovations happening across the length and breadth of NHS in terms of using digital technologies, but also the data that they get through those digital technologies, because you can get data at multiple points in time, and
mm,
that data can then be very, very helpful in terms of making diagnosis at a quicker time, and also making sure that we use the scarce or sort of whatever NHS resources we have as efficiently as possible, which then would allow us to treat or diagnose as many people as possible, and obviously have a significant go at the waiting list. And these things
mm.
are happening across the length and breadth of the country as we speak.
Yeah, it's just moving forward with the resources that you've got. And And I suppose the preventative side of dementia as well can be all, we can test our brains online now. I know that there's some countries now who are designing programs, aren't they, so that we can check our
Yeah,
brain health and we can actually increase our understanding of what we need to do in
yeah,
order to live a better and healthier life. And that
yeah,
that that all can be done sort of behind a keyboard instead of sort of, you know,
yeah.
going and checking in with your GP every couple of
No,
years.
I mean, I don't want to, I mean, because it's not that, we are replacing the human element, because obviously healthcare is such a sort of a human element based aspect, but all the data would significantly enhance the ability of the healthcare professional. So talking about the preventative aspect, if we collect data about, let's say, a 50-year-old person over a period of time, then that data would enable the GP or an appropriate healthcare professional to be able to give some pointed advice to that particular person, because no two people are the same,
Mm,
and that maximizes that particular individual's chances to stay away from dementia,
mm.
or even if they do get dementia, to remain still living well, isn't it? So that's the concept
Yeah.
we talk about. Despite your diagnosis, you can live well. So all of that can be assisted definitely by digital and data. We're
Mm,
certainly not talking about digital replacing human.
yeah.
It's about digital supplementing what
Yeah.
the human does.
Yeah, yeah, and I can see that being more and more. I'm really for it, really. Um, we see less and less now. I know people moan about not being able to see a GP, but do you honestly really need to sit in a GP surgery and talk about you've got a bruised finger? So I can see that kind of like it frees up time for other stuff that can happen there, the
Yeah.
digital side of stuff. What could the wider system do, Venkat, do you think, to help in dementia care?
And I think in terms of just again going back to how the positive development of awareness that happened because the wider communities, the wider system did a lot in terms of promoting dementia awareness. Going back to the Prime Minister's challenge in dementia sort of a few years ago. So it's the wider government and particularly voluntary organizations had a huge role in terms of promoting the awareness. And I think that needs to continue. But
Mm,
also the other thing which I'm particularly passionate about, and for me personally, it's been such a humbling and learning experience for me to be part of Dementia Forward for these last few months, is uh, patients, carers, and healthcare professionals are more like partners when it comes
mm,
to long-term conditions like dementia. And the reason I say that is, whilst healthcare professionals are experts about the illness, it's the family who knows the person the best. And both the knowledge is very important if we were to develop a sort of a supportive system pertaining to that particular individual, isn't it? If it is,
mm,
again, a very short-term condition like chest infection, it's not going to be hugely different between one person to the other. Whereas if it is a long-term condition like dementia, like diabetes, then the uniqueness of that particular individual has a larger role to play in terms of deciding the management or making sure that management is tailored to that individual. And the more tailoring we can get, the more effective the management would be.
mm.
And we actually use the word management as opposed to treatment,
Yeah.
because treatment implies that the expertise lies with the healthcare professional, whereas management implies that it's much more of a joint work. So I think we need to do a huge amount of that. I mean, obviously, we do that in Dementia Forward. That needs to happen at a much larger scale, and that awareness needs to develop amongst the patients and carers, but also among healthcare professionals. And certainly in mental health, we have been very aware of it. So one of the things that I am particularly very proud of is in my organization, we are taking co-creation, which is working in-depth partnership with patients and carers to bring that aspect into the management of mental health conditions, and that needs to happen at a larger scale, and that will give a great opportunity in
Mhm.
terms of, again, the whole point of dementia care is improving the quality of life. And I think if that is a joint effort, then we can do a lot more to improve the quality of life of people involved. And let's not forget about the carers, because we've talked about that a lot in all our meetings. The carer burden for people supporting patients with dementia is immense,
Yeah.
and we need to do a lot more to address that.
Yeah, definitely. And shout out to all of the carer groups out there who are doing all this sort of stuff in the background quite a lot. But,
Yeah.
I do feel that over the last, well, I've been in Dementia Forward now for what, 7 years, and I do feel that the longer I've been in this organization, I have seen that carers are really pushed now
Mm,
to shout out and to have a voice,
mm,
and I think I'm asked quite a lot to talk at things like patient participation
mm,
groups, from GP surgeries and stuff
mm.
like that. There's a lot more willingness now, I think, for health to connect directly with patients and with charities as well, such as
Yeah.
ourselves.
Mm, mm.
So hopefully, yeah, that'll be something that will continue. I think we're
Yeah.
getting there, don't you?
Yeah, we definitely are. We just need to do a lot more of that. And again, it is inevitable that NHS is being linked to finances and everything, and we are in challenging times. But it is worthwhile to point out that carers, particularly family members who we call as informal carers, as
Mm,
opposed to formal carers who are paid people, they do bulk of the work.
yeah.
If going by one particular study, they deliver almost two-thirds of dementia care, and
Mm,
they actually already save the system, the wider
yeah.
system, a huge amount of financial sort of expenses. So it is only sensible, even from
Mm,
an economic point of view.
yeah.
Obviously, it's the right thing to do from a human and ethical point of view, but even from an economic point of view, it makes sense to focus on carers, because they know, I mean, and they have the practical knowledge about
Mm,
how to deal with or how to support people with dementia on a day-to-day basis, isn't it? So there is a lot of learning the wider system can get out of carers who obviously spend the entire day with their loved ones who unfortunately have dementia.
yeah. And I think a lot of carers actually want to do that. They want to look after their loved one. It's just
Mm.
a lot of the times, like without the infrastructure around them, just everything falls apart. So
Yeah,
you're right, from
yeah.
an economic and a humanistic perspective, just
Mm.
throwing some support behind carers is just it's going to help the NHS system from the sidelines, really, isn't it?
Yeah,
Yeah.
definitely. And the sidelines is probably the main headlines, I think, for me going forward. Because again, we've all already, the health secretary has talked about how care should shift from hospitals to community,
Mm,
from preventative to proactive, from reactive to preventative kind of approach. And all of that can happen if we continue to empower our carers and
mm,
then kind of get the ideas from them, because again, what works for one particular person might not for another person, and we need to learn from carers who are able to, obviously deliver care in a way that enables their loved one to be in their own home for as long as possible. And obviously we need to empower those carers as well, isn't it? They need to be almost sort of taking charge of designing how services
mm,
need to be
yeah.
kind of wrapped around the infrastructure that you talked about, isn't it? Yeah.
Yeah. And I think we are doing that, aren't we? I think especially in Dementia Forward, we design
Yeah.
services from the
Yeah,
grassroots up
absolutely.
because, yeah, I think we've moved away from the days where it's all kind of done in a quite a clinical,
Mm.
structured way, where we're all sit around and sing Vera Lynn songs. Um, it's moved way, and
Yeah.
we have our young onset services now out of, our outward bound services. It's all
Mm.
designed
Mm.
talking to people as to what they want and then us designing that
Exactly.
for them. So, yeah, Dementia Forward, I think we're at the forefront of that already.
Yeah, no, absolutely agree. Absolutely.
Um, Venkat, I just want to say a huge thank you to you, as always, for all the work that you do, with your clients. It's so clear that you go way above and beyond everything in your quest to find the best person-centered approach with everybody who's lucky enough to be seen by you. And as always, it's a massive thank you from the team at Dementia Forward for all of your generosity in time and your expertise that you give to us. It's been an absolute pleasure talking to you today, Dr. Venkat, and
Thank you.
long, long may it last that we are in partnership with
Absolutely.
you.
Absolutely. And it's
Thank
been a great opportunity for me. I've enjoyed every minute, and I've actually learned a lot. So if anything, I should be the one thanking you, Fiona, and Dementia Forward for the opportunity.
Oh, well, thank you so much. It's always a pleasure speaking to you, Dr. Venkat. Thank you for your time this evening.
Thank you. Thanks,
You know,
Fiona.
bye.
Bye.